On behalf of the American Heart Association, I would like to welcome you to this session, Approaches to Community Engagement and Collaboration. Throughout the session, you will have the opportunity to submit text questions for our speakers using the questions feature on your control panel. You may send in your questions at any time, and we will review them during the Q&A at the end of the presentation as time allows. To access live closed captions, please click on the closed caption button found on your screen. All sessions will be recorded and available in the coming weeks. It is my pleasure to welcome our speakers for today's session. Brittany Johnson is a licensed practical nurse at the Christ Hospital Hypertrophic Cardiomyopathy Center of Excellence, acting as the clinic coordinator. Isabella Cuenco is a registered nurse coordinator at the Stanford Center for Inherited Cardiovascular Disease. And finally, Heidi Salisbury will be moderating today's discussion. Heidi co-founded the Stanford Center for Inherited Cardiovascular Disease in 2006 and is the program operations coordinator at the center. As a reminder, full speaker bios can be found in the event lobby. Isabella, the floor is yours.
Thank you so much, Renee, for that kind introduction, and thank you to the AHA for putting together this forum to discuss HCM and everything HCM. So I'm going to share a little bit about how our center does community engagement over at Stanford Center for Inherited Cardiovascular Disease. So our center has 4 pillars of community engagement. The first is through communication. The second is through support. Third, through outreach and engagement. And fourth is through advocacy. So in this presentation, I'll share a little bit about the specifics of each and how we are able to build community for our HCM patients. So the first way is through communication. Our center offers a quarterly newsletter called SCID Pulse. In it, it has many different topics from recent events, features in the news, spotlight on our different teams, whether it be through nursing, our genetic counselor teams, our research teams, or provider teams, any recent publications, research highlights, clinical trials and research opportunities, as well as patient resources. We found that we get a lot of clicks on a lot of the clinical trials and research opportunities, as well as patient resources. As you can see, most of our patient clicks come from the US, but we do have a few little international reaches. The newsletter reaches about over 4,500 people every quarter, and those that are registered range from patients of our clinic, those who have registered for our My Heart Counts run, which I'll discuss a little bit more later in the presentation, anyone who reaches out to our clinic and wants to be placed on the mailing list, as well as anyone who opens a letter has the opportunity to subscribe at the bottom of the newsletter. The second pillar is through our monthly peer-facilitated support group. This was established in February of 2022 and has served about 550 people to date. It's typically scheduled on the first Monday evening of every month, and the support group is open for anyone to join. Doesn't have to be a patient of our clinic. It can be open to anyone in the community who'd like to join. The support group is split into 2 parts. First is through an education topic with speakers, and I'll go over some of the different speakers that we've had present. And then second is a breakout session that is led by peers in different discussions about the education topic. To date, there's been about 22 different educational topics and speakers that have been discussed, and it offers patients a reliable source of information on community advocacy and different research opportunities. The peer facilitated support group is a novel framework of support And this will be presented at the PCNA conference later in April. Here's some ideas of the different programming that we've had in our support group. Different topics, everything from psychosocial, things that our patients would be interested in, such as exercise and cardiomyopathy, genetics, what it's like to be coping with an ICD, navigating different clinical decisions, family care. The third pillar is through outreach and engagement. The cornerstone of this is our My Heart Counts walk and run event that celebrates life, heart health, and wellness. We've had over 1,300 participants in the last year, and we've been able to raise about $38,000 for education and screening programs for heart disease, providing heart disease tests for those in need, advancing cutting-edge research to prevent or cure heart diseases that still take too many too early. Another part of our My Heart Counts run is an expo where we have 25 different vendors. These vendors are our community partners, and it helps to connect patients and our families to some different resources in the community. It also features our Heart Heroes. Heart Heroes are our patients who share the why and why they're participating in the My Heart Counts run. This year, we have had our Heart Heroes share their why in a video clip that's been sent out in weekly emails that we've been sending to those who are registered for the run, and also in our newsletter in the weeks leading up to the event. A few pictures of some of our previous runs. Everyone gets a shirt and a medal on participating as well. And the fourth pillar is through advocacy. So there's a few different ways that we provide patient advocacy. The first is through our SCID seminars. These are a series of talks from experts in our field, in their field, and it's open to anyone in the community. It's usually every season we offer a series of talks, and anyone is available to join. And continuing education credits are also offered as well. We have partnership with different advocacy groups, including HCMA, the DCM Foundation, partnership with those in the industry, and then also partnership and outreach with different advocacy groups and associations, including AHA, ACC, PCNA, HFSA, and the HCMS. Thank you so much for allowing me to share a little bit about how our center advocates and builds community with our patients. And happy to participate in this and share in our discussion.
Thank you so much, Isabella. That was really, really good. I really appreciated your presentation and just outlining the different ways that you can access and support a patient community. I know we're going to have time for questions here, but first we're going to transition over to Brittany.
Hello. Thank you, Heidi, for that introduction. As mentioned, my name is Brittany Johnson. I'm an LPN in Cincinnati, Ohio at the Christ Hospital Hypertrophic Cardiomyopathy Center of Excellence. So I have no disclosures. Hypertrophic cardiomyopathy has been reported as being as prevalent as 1 in 200 and 1 in 500 people worldwide. Of those individuals, a staggering 85% remain undiagnosed. So being aware of the existing gap, our team really wants to try and focus on those currently untreated and at risk in the community, specifically minority communities, as these tend to make up a smaller existing population within our existing clinic. We're going to be talking today about community interest, how to educate by awareness, and how to commit to care. "85% is a very large number of individuals, and it can be daunting to address. So the first question we wanted to ask ourselves as a team was, how do we tackle this number in our community? We thought the best way to cast a net, so to speak, close to home. We're focusing on areas in the immediate proximity to our facility. Our reasoning behind this was to see how we can help those closest to us with our current resources available within our city. We wanted to better understand the social economic status and history of the surrounding communities. Many of our regular patients often struggle with transportation. This also holds true for our HCM patients. Many go undiagnosed for the pure fact that they have no way to get to the doctor. Through our foundation, we are providing means for rides for people back and forth to the hospital and for their appointments. And we want to be able to use this to try and help people get into our clinic. At larger events, there can be a lot of vendors that tend to distract people to make them feel nervous and not want to hold one-on-one conversations. We were able to target smaller community events with smaller crowds, which give people at more ease to talk. We try to keep things light and airy, yet remembering to engage and educate these communities, which is our main goal. It's been really nice getting to learn our patients on a one-on-one basis outside of the clinic. It's been really nice also to really start to explore and learn about each neighborhood in our city and the background. Each of these neighborhoods will have some sort of event throughout the year, from a food drive, a coat drive, a health fair. All we need to do is reach out to the hosts of these events and see if they can collaborate with us. Events, large or small, are not the sole route to engaging with the community. We also should partner with community leaders and business owners. For example, barbershops, bookstores, community rec centers, coffee shops. These are all areas that have high traffic and people tend to spend a decent amount of time there. Reach out to them. Do not be afraid to get creative with your education events. Think outside of the box and make it fun. There are several papers published regarding the connection between men's health and barbershop. So this is something we could really explore more. They may be willing to display our information or set up an education. As prevalent as HCM is, little is known by the general public regarding the disease or its signs and symptoms. Some know nothing, and some only know what they've learned in the media or from a tragic news event. While we're preparing for our first event, I took upon myself to ask some of my family members what all they knew about HCM and if they could identify any signs and symptoms. I love them to death, but they could not. But their incorrect answers did help us to realize what information was needed to be put out into the public. We want to remember when we're educating the public to keep it brief and informative. We want to make sure that we're using terms that are easily digested by the people who are not necessarily involved in the healthcare field, layman terms. We use information straight from our home website, from the HCMA, and from the AHA to develop our pamphlets and our welcome letters. These are some information that we take with us when we go for our programs. Handouts about your program are nice to have. Not every person learns the same way. Some people are visual learners. Some people are able to retain the information just by spoken word. But we want to make sure we're covering all the bases and bring all the materials that you possibly need. And any material that you do have, you want to make sure that you have your contact information on the information so the patients will be able to find you. We also wanted to include some health maintenance education as in our program. So we incorporated a blood pressure screening. We were able to collaborate with the Women's Heart Program here at the Christ Hospital to donate blood pressure cups and information regarding how to properly take your blood pressure and blood pressure diaries. We were demonstrating how to use the blood pressure cup proper way and gave them a blood pressure log and how to contact their personal cardiology or primary care provider if they wanted to go that route to learn more about their blood pressure, if they didn't want to establish with us. At the end, we tied it all together with a simple game, a knowledge check. Games can be a great tool. They engage the person and present the information that they've already learned in a different format. This will help our possible future patient to retain the information. Our game consisted of questions taken directly from the information given orally and information handed out to them from our information. Here's a little example of our game, the little spin wheel. You answer a question, you get a prize. Get a wrong question, wrong answer, that's fine. We'll give you the right information and you'll still get a prize. A good little tip that we did when you got your prize, we attached some information regarding HCM so the patient can take it with them. Here's our display and our game. So we identified the need. Then we need to target our focus and we acted. Now what? We must be able to commit to care while the person is there in front of us. We wouldn't want the patient to leave with all this new information and afraid of what could happen without a way to get scheduled. Prior to your event, you should contact people within your health network, EP, social work, genetic, primary care, to see if they would be able to withhold some appointments for you for these patients that you would meet here at your event to get scheduled there. So in conclusion, community interest, education, commit to care are the three big things that we use in our community engagement.
Brittany, thank you so much. That was perfect. Got Brittany back and Isabella back. Perfect. I'll have you both go off mic. And we have about 10 minutes for questions. There are a lot of questions. And so I want to make sure that we're able to go through the majority of them. And so, Brittany, I'll start with you since your voice is all warmed up. And just thank you both for all of your work advocating for this special patient population and for really setting the standard for how you support this community. You're both doing an incredible job. I learned so much, and no doubt the audience is as well, because there are a lot of questions. So let's go with Brittany. There are significant disparities regarding HCM diagnosis among patients of color, as well as genetic counseling and clinical trial engagement. Disparities in genetic counseling and clinical trial engagement for individuals with color. How to help to close this disparity to engage these diverse populations so there are more advanced components of, I think, to optimize HCM care for this population?
That's a great question, and it's a very tough one. I think it all goes back to us trying to repair and build the trust within the community. There's not been a great history within these communities with the medical field. So trying to remain a staple in the community and educating ones at these events I think it'll be a key way to build the trust, to try and get these patients into these trials and studies and get appropriate testing.
Helpful. Thank you. Thank you. Right, Isabella, this one is for you. In response to some of the community work that you shared, two questions I think I can fold into one. Can you just explain a little bit more about the vendors that participated in your community run? And then second, for patients who are interested in attending some of the run and or the support group, how might they do so?
Sure, great question. So some of the vendors that we have participate in My Heart Counts are different patient groups, community groups, and advocacy groups. A few that were mentioned in the presentation include HCMA. We also have some local outreach of some of our local heart health organizations and cardiac rehab organizations that also participate as well. Information on our run and as well as the support group can all be found on our website. And I can also share the link to the support group through the question and answer portal here as well.
Thank you. Thank you so much. Okay. So if an audience, if you do have additional questions, go ahead and drop them into the Q&A. I'm going to move on to some prepared questions that we have. But really, we want you to use this time while you have Brittany and Isabella here and have access to their wisdom. So don't be afraid to please drop in your questions into the Q&A. But Brittany, I'll come back to you. How has community-based, community-engaged care impacted the quality of your clinical care for patients?
So it's given us a chance to really get to know our patients on a more one-on-one basis and realize that they're not just an MRN, these are people and they have lives. And to really get to the nitty-gritty of what they need just outside of their cardiac care also. Sometimes as a nurse, you have to be more than just a nurse. Sometimes you have to be a social worker. And then the community care or the community engagement really kind of opened our eyes into what else could be needed in our clinic.
I love what you just said there. You engaging with your community and engaging with the individual makes them more than an MRN. That's such an important mantra to adopt, and it's so true. Isabella, what are your thoughts on how your efforts to engage with the community and the individual has impacted their clinical care?
Yeah, great question. I agree with what Brittany said, that it's all about engaging and making them more than just a number or record. It's seeing beyond kind of the diagnosis and how it's impacting their lives. I think for us, in terms of the clinical workflow, it's allowed us to try to implement new ways and strategies to bring them into the community and show them that, you know, it's not just the diagnosis, they're not alone. There are other resources and community that they can have access to. In our particular workflow, what we've been doing is creating smart phrases in our clinic. Usually it's very multidisciplinary. We have the provider and the physician, our genetic counselor, and then as well as our nursing team that comes in. And when our nursing team comes in and gives them a little bit of an intro about how our clinic works and how the team works, we're able to share with them some of those resources, such as our run, the support group, the newsletter. And so we're able to utilize our charting system through smart phrases to just pop that into the AVS, the after visit summary, and they're able to have that information with them already from that first point of contact.
That's great. Stepping back a little bit, we're all nurses here. We know the importance of a good needs assessment before any intervention, so we can really gauge whether our intervention is going to be therapeutic, is going to be effective. So to those in the audience who don't even know where to start, how did you really, how did you conduct a needs assessment of your community so you could be responsive when you set up your different, pillars of support in the community and different interventions? Brittany, you want to go first?
Sure. Well, we saw within our clinic, we tend to still have the same type of individual coming through the door. We didn't have much diversity. So that made us really take a step back and realize, how can we change ourselves to be more inviting to other people of different backgrounds, different nationalities, to come and establish with us and what those communities need in order to get established with care.
Yeah. Isabella?
Yeah, that's a great question. I think with the way that our clinic is set up, upon the first meeting, the first time that a patient comes to our clinic, they meet every member of our team, and we're able to have a discussion around what their needs are, what everyone's input is. And because that from that first meeting, they're meeting everyone, we're able to really build upon what they need and provide an individualized approach for each patient, and showing that it's definitely a team effort, and we're with them through it.
Clearly, you both lead teams that value building a relationship at the foundation of your patient care, and I think that's really, really important. Then that we always have to balance the amount of effort expended to the return on our investment. And so, what have you found? How have how's the patient participation been for your model in the community? Brittany, I know this is a challenge. It's a challenge. So what was patient participation looked like for you?
It can definitely be a challenge. And we actually have a larger event that we're putting on here in May for the American Heart Association, the HCMA, the Big Credit Warrior. And we did reach out to some of our patients to see what all information that they would like to see be presented at this event. So we want to continue to help them grow with us, but with information they'll need.
Yeah. And Isabella, same question for you. What's patient participation actually looked like?
Sure. I think patient participation, sometimes it can be a little bit tough at the beginning to kind of have them to buy in and to understand all of the different resources. But I think because we're able to have such a high touch point with some of our patients, whether it be through the telehealth systems or through messaging patients and being able to just provide the resources for them, I think just the fact that we're able to have it available and able to answer the questions when needed is really helpful for patients.
Great. In our final 2 minutes here, I'm going to kind of merge a few questions together into one, with the goal of hoping our audience can walk away with some practical, pro tips from the two of you. While you talk about in community work and have presented the amazing work that you're doing, a lot of times our efforts to engage with the community are not really, there's not space for that in our clinical practice. Your patient care can be consuming, and the day-to-day tasks of clinical work are consuming. How do you balance that? How do you find the time and the support from your clinical team to effectively engage with your community? Lessons learned or tips from you, starting with Brittany.
Work-life balance is definitely a must, especially with a disease that has so many aspects. And at times it was challenging, but I think now we have a pretty good balance. We're really responsive with getting to our patients quickly with their needs, and we're able to manage ourselves as well without being too stressed, because if we're too stressed, then we can't take care of our patients.
Yeah, absolutely. Thank you, Brittany. Isabella?
Yeah, I think work-life balance is definitely very important. And I think trying to also optimize strategies and ways to make it easy for the provider team and the clinical team to provide these resources for patients without finding it to be overextending or overreaching. So I think it's all about optimizing workflows and making it easy to be able to have that communication with patients.
Yeah, that's great. Really good practical advice and wisdoms from the two of you. Thank you so much for leading the way for your leadership and for showing us these really approachable ways to stay connected with our community and to advocate for a really vulnerable population. So I just wanted to thank you both and look forward to continuing to work with you, of course. Thank you.
And thank you, Heidi, for leading such a rich conversation around community engagement and collaboration. Coming up next at 1:40 p.m. Central, we will have components of HCM care, implications of genetics across the continuum. To access this session, please exit this session and return to the lobby using the menu at the top of your screen. From the lobby, click on Sessions, and then click on the individual session to join. Thank you very much for attending today's HCM Connection Forum. We will see you shortly.